With regards to non-communicable diseases, there are a variety of population-based strategies that are important tools for public health. They include screening for early detection and treatment, multiple risk factor interventions, identification of cost-effective treatments, genetic counseling and intervention, and research. These strategies are used to try to reduce the burden of non-communicable diseases within populations and communities. Screening is an important tool used in public health. Screening for disease can result in detection at an early stage, under the assumption that early detection will allow for treatment that will improve health outcomes. Successful screening programs will reduce disability and death due to these diseases. Some key characteristics about screening include that they are used on people who are asymptomatic. Screenings are not diagnostic tests. Screenings are used to identify individuals who might require additional diagnostic tests. It's important to know that a diagnosis is not made based on a single screening. However, screenings do allow for early detection and treatment to improve health outcomes. We're familiar with a variety of screenings, including those for breast cancer, things like testicular, colon cancer, diabetes, hypertension, and heart disease. Let's take a look at a few resources. This is the American Cancer Society's page relating to breast cancer. Here is a page that has breast cancer basics, signs and symptoms of breast cancer, and then more about breast cancer. So if we look at the link, it'll take us to a page related to early detection and diagnosis. We find lots of information about breast cancer, tests, treatment, etc. This information is provided by a credible organization, the American Cancer Society, and it's important in terms of getting information to the public related to screening for breast cancer. This has contributed to a decreased rate of deaths due to breast cancer. Another resource for screening on the American Cancer Society's webpage has to do with testicular cancer. Testicular cancer is the cancer of young men. Prostate cancer is the cancer of old men. It's important to get the word out to young men to do screening for testicular cancer. This can be done at home, the same way a breast self-exam is done with women. I need to mention, breast cancer is not exclusive to women. There are men who get breast cancer. So again, looking at the page related to testicular cancer, they give you a lot of information about it in terms of signs and symptoms, causes, treatment, etc. This is all important information and part of a public health effort. The American Cancer Society is just an example of one organization that provides information on screening for the reduction of disease. Others include the American Heart Association, the American Diabetes Association, and others. An important task force that provides information is the U.S. Preventative Services Task Force. I want to take a few minutes now to look at their website. The URL for this webpage is uspreventativeservicestaskforce.org. As you can see across the top, there's a scrolling announcement for different recommendations related to screening. Besides screening recommendations, they also ask for comments from the field related to existing screening. Here, for example, is the new recommendations for PrEP prevention for HIV. Let's take a few seconds now to look at an overview video related to the U.S. Preventative Services Task Force.
Every time a primary care clinician sees a patient, it's an opportunity to prevent disease and promote good health. The range of available preventive services is extensive, and new evidence about what works continually comes to light. How does a primary care clinician know the best preventive opportunities for each and every patient? To address this challenge, more than 30 years ago, an independent volunteer panel was created, the United States Preventive Services Task Force. The task force reviews all the research on specific preventive services and provides evidence-based recommendations. Each member of the task force is a nationally recognized expert in disease prevention and evidence-based medicine. Most are practicing primary care clinicians. The preventive services they evaluate include screenings, behavioral counseling, and preventive medications, ways that can help prevent disease before there are any obvious signs or symptoms. Before a final recommendation is made, materials are open to scientific review and public comment. Then, after all input is considered, a final recommendation is published. If there isn't enough evidence to make a recommendation, the task force calls for more research, and each year reports to Congress on priority research gaps. Every task force recommendation becomes a valuable evidence-based tool that primary care clinicians can depend on. With the help of the U.S. Preventive Services Task Force, primary care clinicians, their patients, and their families have the knowledge they need to help prevent disease and promote good health. For more information, visit uspreventiveservicestaskforce.org.